Welcome to Duke Spine Institute. This is our live stream. It is Tuesday, December 17, 2024. I'm Dr. Duke Majan, CEO and founder. Our first patient travels here from Arizona. She has horrible back pain in her lower back as well as her buttock on the left and her SI joint on the left. So she's got 2 discs causing her back pain. She's also got a piriformis syndrome, which is a torn muscle in her buttock, and she's got a sacroiliac joint pain as well. Shot? All right. Now, the 2 discs we're going to fix with laser surgery. The SI joint we're going to denervate. That's the best treatment in the world. And the piriformis muscle we're going to release because that's the best treatment available in the world today. We're going to give her the very best treatments that are curative. The key word here is curative. What does curative mean? It means you are curing pain from that source permanently. And the truth is that there is very few curative treatments in the world for pain, but Duke Spine Institute has pioneered and developed the actual curative treatments for 99% of back pain at this time. All right. If you have questions, feel free to ask us. I'm going to go ahead and place the needle into the disc at L4-5 first. Shot. Henry,
Yes,
while
sir.
we're waiting for our audience to warm up this morning, why don't we show them the 30 different things that cause back pain commonly, chronic back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us.
Phoenix. Welcome back. This patient, who is from Arizona, has had back pain for 5 years. When I examined her on Zoom, I discovered she had pain from 2 discs that were damaged, L3-4, L4-5, as well as pain from the SI joint on the left and also the piriformis muscle. Now, the reason she has disc pain, we're going to show you in a moment, inflammation in the tear in the back of the disc, in these 2 discs. Inflammation in the SI joint on the left and inflammation in the piriformis muscle from a tear in the muscle. Today we're going to be fixing 2 discs, left SI joint, left piriformis muscle. This is 4 causes of her back pain. They're all contributing, but the biggest cause is the disc. We're going to start with those. She is awake. Are you comfortable? All right, don't move. We're going to put you to sleep in a minute. How bad is that on a scale of 1 to 10? What's the highest?
9.
Is that where you get your back pain? So I just tested the disc with a discogram, and it's 9 out of 10 concordant. All right, good job. That pain will be gone when you wake up. How bad is that pain? Huh? The highest. 9. Is that where you get your pain typically? Good. Just lay still. All right. We're going to be... So she has concordant pain at L3-4, L4-5. When I injected the dye, it made the disc painful. Normally you inject dye, it does not make the disc painful if the disc is normal. But when it's a painful disc causing her daily back pain, it reproduces the pain when you inject it with some liquid. That is called an evocative discogram. I did not discover it. It was discovered long before I was doing them, but it's a great test to confirm the sources of her pain. We know that she has pain here from the 2 discs, 9 out of 10 at both. She also has SI joint pain and piriformis. We're going to fix those later. We're going to start with the 2 discs. Henry, let's show the audience how a disc injury can be so painful.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Let me know if I can proceed. All right, you can see from our animation that the way a disc causes so much pain is through inflammation, and what's inflamed is the posterior tear. Any questions?
At this moment, no current questions.
All right, Henry, would you share with the audience how we fix these
Of course.
torn discs
Of course.
that are so painful for people?
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Obstruction. Welcome back. So you can see from our animation that we can get rid of the most common cause of back pain in the world. It is called discogenic back pain. It means pain originating from a disc injury. That is the #1 reason people get back pain in the world is discogenic injuries. It's 85% of chronic back pain, according to our research at Duke Spine. We looked at 5,000 patients with chronic back pain. And chronic just means it's been there for, more than 2 weeks. Typically it's there for years, like this lady, 5 years. And in the 5,000 patients, 85% of them, oh, look at that inflammation right there, Henry. That's exactly what we've been talking about, folks. You see the pink?
Yes,
That is
we do.
inflammatory tissue. That's where all the pain is coming from. This is like digging for gold and finding gold right when you look inside. This is wonderful news. We're going to be able to get rid of her back pain from the discs. Laser. Any questions? You can see the tear there as well, the annular tear.
At this moment, no current questions.
All right. Thanks, Nikki. Well, I'll just talk then. So we are here to fix this lady's disc pain. She has 2 discs causing pain. She comes from Arizona to the Duke Spine because they can't fix her pain in Arizona. Most doctors don't even know that the discs cause pain when they're damaged. So they end up telling patients to just take medicine the rest of their life. And these people take medicine, but the medicine never fixes their pain. It just temporarily provides some temporary relief. And of course, these medicines are addicting, highly addicting and dangerous. A lot of them are narcotics. Or some people self-treat with alcohol and they become alcoholics trying to get rid of their pain in their back or neck when it's really easy to fix now. Unfortunately, doctors don't know how to fix this pain. Duke Spine does. I'm not trying to brag or anything. I'm just telling you folks the truth. So if you go to your local doctor and say, do what Dr. Duke Machen does, they won't know what you're talking about, okay? And you're going to stay in pain, unfortunately. They won't be able to fix you. You've got to come to Duke Spine Institute. We are the world's leaders in curing back pain and neck pain because we're able to, #1, make the right diagnosis. It all starts with making the right diagnosis. You saw a few minutes ago the video on the 30 causes of back pain. Well, each one of those is a possible candidate in every patient. Turns out that the average patient with chronic back pain has four causes. This patient has 4 causes, so she's average. Some patients, I've seen them with 7, 8, 9, 10 causes of back pain when I examine them. By the way, this is important fact. MRI scans don't tell you where back pain comes from, okay? MRI scans never tell you. There's no test in the world that tells you where back pain comes from except for one test. It's called the Duke Spine Exam. The Duke Spine Exam. And it's a combination of physical exam and evaluating diagnostic imaging. All right. There is the back of the disc. You can see the pink material, right? Hold on. Trying to sharpen my image. There we go. So that's the outer fibers of the annular tear. There's a lot of scar tissue here, inflammation. There's some herniation right there coming into view. We're going to get rid of it. Henry, any more videos you want to share with our audience?
Yes. Since we showed our audience the most common causes of back pain, which is a herniated disc, let's show them the second most common cause of back pain, which is the facets.
Sounds great to me. All right, Henry, now that you've shown them how facet joints can cause pain, let's show them the best treatment in the world for facet pain, which is available at Duke Spine Institute only.
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see how we fix facet joint pain at Duke Spine Institute, and we're going to be doing that surgery later today. Any questions?
At this moment, no current questions.
All right, we'll just operate. For those of you who are interested, the laser you're seeing right now is literally 1 millimeter across in diameter, that glass fiber. It is fiber optic. It transmits laser energy from a machine here in the operating room. That machine is a $200,000 laser machine nowadays. If you want to buy one, prices have gone up, and there's a reason why, unfortunately, why medicine is expensive in the United States. Number one, the insurance companies aren't paying for it like they're supposed to, and number two, the equipment is overpriced and the drugs are overpriced. Everything is overpriced. If you have questions, feel free to ask them by typing them. We are live streaming on Facebook, LinkedIn, YouTube. This is a little bone spur here. And
Twitter,
X.
Yes, to X, Twitter, Instagram, and Kick, and we'll be looking into more streaming services to broadcast on soon.
That's awesome. And they all come off the same platform?
Yes,
Is
Restream.
that Restream?
Yeah.
And what is OBS then?
OBS is like the where I can do all the sources, like where I can just coordinate the live stream as it should be with the videos. Like that's where it's the live stream is structured.
Is it software or hardware?
Oh, it's software. Yeah. 100%.
I see. So OBS is like the platform you use for the stream.
Exactly, correct. And then Restream is to connect it to all of our social media. That's our integrator.
All right, we are done at this disc. Let me just zap this last bit right here. All right. One disc is done. We're moving on to the second disc next.
One medication, you can't use your anesthetics with her. That's ketamine.
Because of her epileptic. Uh-huh.
So most drugs are anti-inflammatories, right? Like propofol with GABA.
Oh, I didn't know.
Versed is a.
But ketamine is a pro-stimulant for
Yeah.
pro-excitatory,
Exactly.
or inhibits GABA, or what?
It works with NMDA, but it definitely is excited.
All right, one down, one to go on the discs, and then we're going to end this stream, and we're going to come back with the SI joint Duke plasma rhizotomy for sacroiliac joint pain. Approaching the Christmas holiday and Hanukkah. When does Hanukkah start?
I think it's the day after Christmas. It's on the 26th, conveniently. Yeah, it's on the 26th.
I thought it was before. Maybe last year was before.
Last year it was before, but then I think
Whoa, Sean?
Thursday the 26th is Hanukkah.
So,
first
so Hanukkah, it's not the same day every Christmas time.
No, it's actually very fluctuating because it could sometimes be in the middle of December. I think one year it was in the beginning, and then and it just goes. It's very fluctuating in the month of December. It's weird, but it's all good. Oh, we have a question.
Excellent.
This is coming from Carolyn on YouTube.
For sure.
Asking,
Carolyn,
asking, I have a very painful neck where a lot of pain is right along the base of my skull. What causes that?
Yeah, great question, Carolyn. We need to do an examination to tell you. So I can give you your answer, but you have to do what's called the MRI review. And the MRI review is free. You have to go to our website, dukespine.com, and then you can do the MRI review with us. But in the end, we can't tell you just based on a description of where the pain is. We have to see your MRI. We have to do an examination. That's the only way we're going to be able to tell you what's causing your pain. Otherwise, we'd be guessing, and we don't guess. Nobody wants a guess. People want facts. They want a diagnosis. To get a diagnosis, which is the source of your symptoms, we must have more information. Shot? All right. But there are several things that could cause it, and the most common is going to be the facet joints, FACET joints, which we just showed you the video on that, and it's totally fixable. Okay. Another possibility is a disc herniation. So it's either the disc, the facet, but then there's other things like rheumatoid arthritis, pannus, instability, fracture, like a C2 fracture, C1 fracture, occipital neuralgia. There's different causes, but I can't tell you what yours is without examining you. The good news is it's free. We don't charge any money for the MRI review. You get 10 minutes with me on Zoom. You get asked questions, but most important, you get a diagnosis. That's the most valuable thing I can give you on that Zoom call, a diagnosis. All right, just about in. And now we're in. We're going to fix this disc. This was a 9/10 pain. When we tested it, she said that's 9 out of 10, and that's where she always gets her pain.
We have a couple more questions.
Yep.
This next one coming from Essential Advantages on YouTube.
Welcome back, Essential Advantages.
Asking, what is the best way to get rid of scar tissue deep in the neck?
Great question. So the best way to get rid of scar tissue deep in the neck is to leave it alone. The scar tissue does not cause symptoms. Okay? Scar tissue does not cause symptoms. What causes symptoms is inflammation. So you want to get rid of the source. See that pink stuff right there on the endoscope? That's inflammation inside the annulus. It's caused by the blue stuff being there. The blue stuff is the herniation. The herniation in the white thing, which is the annulus, causes inflammation. And that's what we're zapping away with a laser. So we don't remove scar tissue in the neck ever. There's no reason. Any doctor that tells you to remove scar tissue doesn't understand what's happening, and I wouldn't let them treat me. There's a lot of doctors out there who don't understand the causes of pain. I would recommend you stay away from them. This disc is more recently herniated. Look at its characteristic compared to the last one. The last one was collapsed down, full of scar tissue, inflammation, dried up disc. This one is fluffier disc, fluffier herniation. This is a newer herniation.
We have a couple more questions.
Uh-huh.
Next one coming from Faisal on Facebook,
Hello, Faisal.
asking, "Hi, doctor.
Hi.
You do an MRI review. Do you still offer the 1-year surgical guarantee that's on your website? Thank you."
Yeah, we offer a guarantee, Faisal. So Duke Spine is the first and only spine center in the world to guarantee you're going to be satisfied with the surgery we offer, or we continue to treat you until, at no charge to you, until you're happy and the pain is gone. Now, the guarantee requires that you, number one, you have to pay the full charge, which is basically the non-discounted rate. So a surgery like this, for example, the charge would be $130,000 US. But this patient did not pay that. They got a discount. They paid much less. And if you want the guarantee, you're going to pay the full charge. Okay? You're going to pay the full charge to the surgeon, the anesthesiologist, and the facility. It's just one bundled price. And if you pay that full charge, we give you a year guarantee that you're going to be very happy. Otherwise, we'll bring you back and treat you at no cost to you. I mean, you have to pay for the trip, you have to pay for the hotel and the airline, but we pay for the treatment. No cost in terms of diagnostic tests that we order and do here, no cost in terms of treatments that we do here. Now, of course, you're going to have to get your treatment here. You can't go somewhere else and get treatment because we're not going to pay for someone else's recommended treatment that we don't agree with. So it's treatment done here at Duke Spine after your surgery, and you have to pay the full charge. And you have to have a written agreement with us in advance of surgery. In other words, the CEO has to sign off saying you have a guarantee in writing, which I am the CEO, so I would sign it. But you can't just come and get a discounted surgery and pay a little bit of money and expect us to treat everything that causes back pain for the next year. That doesn't work that way. Since there are 30 things that cause back pain, we're not going to give you 28 other treatments for free when you paid for 1 or 2. We would go out of business. That doesn't make sense. We're guaranteeing that what we treat is going to work, or we treat you until you're happy. That's the guarantee. Yes, we offer a guarantee.
We have a couple more questions coming from Carolyn once more on YouTube, asking, "I'm unable to get an MRI due to spinal cord stimulator. Is a myelogram enough for you to examine?"
Carolyn, you said?
Carolyn, correct.
Hi, Carolyn. Yes, dear. You do not need a myelogram. Please don't get one. They're dangerous. They cause arachnoiditis. You don't want that. What you want is a CAT scan or CT scan. That CT scan should be good enough. Okay? Just get a CT scan, submit it, and I'll do the Zoom call with you for free. Okay? But you don't need a myelogram. Please don't get a myelogram. Myelograms are horrible tests. I never order them. They are totally unnecessary, and they are very, very dangerous. People get spinal fluid leak. They get infection of the CSF called meningitis. They get arachnoiditis from the dye, irritating the nerves, causing inflammation. You do not want a myelogram. Don't let anyone do a myelogram, ever.
Next question coming from AAKK on YouTube,
Hello, AAKK. Welcome.
asking, "A few weeks back, you had treated a patient with discitis using the laser endoscope and placing vancomycin at the edge of the annulus.
You are correct.
I wanted to ask how the patient's clinical outcome was after. Thank you, doctor."
Great question. Thank you. That patient is doing amazing. He went back to work. He was a workers' comp injury, injured his back on workers' comp, and we did that surgery. The other surgeon wanted to do a fusion because he had a listhesis at 5'1", and his infection is gone, and he's zero pain. I saw him in clinic several times afterwards to check on him. His infectious disease doctor has cleared him. His infection is gone. His lab levels are back to normal, his sedimentation rate, C-reactive protein, and he actually came in saying, please send me back to work. This was like 4 weeks ago. We did. We gave him some restrictions, don't lift over 40 pounds. And then he said, please take away my restrictions. I want to go back to unrestricted work. So that guy is back to work. His infection is gone. His pain is 100% gone. He is very happy.
I can't remember what he did for a living.
What did he do? What kind of work did he do? I don't remember. Do you remember? Anybody remember?
I think it was something with boats, no?
Boats?
Yeah.
Like a mechanic?
Something like that, I believe so.
I don't remember. I think he was some type of mechanic or something, or driver, truck driver or something, but yeah, he went back to work. He's perfect. He's very happy. They were skeptical when they came, they didn't know, because I'm very confident in my diagnosis and treatment. They were like, are you sure? Because the other surgeon said we need fusion with screws and rods. And I said, no, you don't. We can fix this without fusion. And afterwards, they believed me because his pain is gone. He's doing fantastic.
That's not the best environment to put screws and rods into.
No, you never want to put screws and rods when there's an infection. It's going to infect the screws and rods. That's why I didn't use them. See, surgeons know, I wish I could train more surgeons to do right decision making. But anyway.
We have a couple more questions.
Yep, we'll take them. We're almost done with this disc, and then we're going to end the stream. We're going to come back. We'll be doing an SI joint rhizotomy. SI joint rhizotomy next. Remember, she has 4 causes of back pain, 2 discs, an SI joint, a piriformis. Those are the 4 causes. We're going to fix all of them because she traveled all the way from Phoenix on the other side of the United States, and she's here to get fixed. She's here with her friend who was kind enough to help her, and really appreciate her trusting us to fix her back. She's going to be very happy.
Next question coming from Essential Advantages once more on YouTube, asking, how would I know if I re-herniated a disc?
You need me to examine you and tell you if you re-herniated. So sometimes you can tell if you've re-herniated if you look at the MRI and there's a gigantic herniation. It has to be bigger than the one you had before surgery. And then you've re-herniated. But just having a disc herniation after surgery is not a diagnosis of re-herniation. The most important thing is you're doing something you're not supposed to do, like lifting heavy, bending over, picking things up from the ground when you're not supposed to, while you're in restrictions. And then you feel a pop in your back, and you have pain. Pop with pain. That is a really good indication you've re-herniated. But we have a lot of people who have other causes of pain, and they think they've re-herniated, but they haven't. They just have something else causing their pain. And what I have to do is do an examination. I will tell you what is causing your pain if you do an MRI review with me.
Next question coming from Faisal once more.
And let me just say one more thing.
Of course.
Re-herniations do happen with this surgery. It's 1% of patients. But every time I've ever seen a re-herniation, it's always with the patient telling me I did something I shouldn't have done. I knew I shouldn't have done this, but I did it. And then they feel a pop in their back, and they re-herniate. So just follow my rules and instructions. You won't re-herniate. It's very, very rare to re-herniate if you stick with the restrictions. All right, we'll take the next question from Faisal, and we'll finish up questions. And these are all pieces of herniation right here, by the way. See them? I'm pulling them all.
Yes, we do.
They're like little pieces of cotton. I'm going to show them in a moment. When we're done, I'm going to show you on the patient. Look at that. Look at that. More of it.
We can see it? Yep.
I'm going to show you some pieces in a minute. There's just a lot. So when this person hurt this disc, they blew the nucleus into a lot of little pieces. And those little pieces are working their way out through the tear. And every time another piece comes out, it creates another cycle of pain, inflammation. And it just never ends. There's the tear right there. That's the top of the tear. That's the end of the tear. You can see the fat right there, the yellow fat in the epidural space. So we're pretty much done with this disc. And then we're going to move on. Go ahead, I'll take the question.
Coming from Faisal once more on Facebook asking, Doctor, it's great to learn from you that inflammation causes pain. If there was a scan that showed pain due to inflammation, which is a separate scan from an MRI or a normal CT scan, would that help you?
Yeah, that's a great question, Faisal. You're right. So the inflammation that we're dealing with is extremely small. It's extremely small area. And the scan would have to be very sensitive. But you know what? Technology these days, it probably exists. That said, lots of people have inflammation without pain. So that kind of a scan could potentially lead to overtreatment. The key is to correlate the inflammation source with the site of pain that the patient has. And you got to verify it on exam. And that's the magic of what we do at Duke Spine. We're able to do that. So yes, a scan showing inflammation would probably be helpful, but if you just use that scan, you're going to end up doing surgeries and treatments the patient doesn't need, because just because they have inflammation doesn't mean it's causing their symptoms. There's going to be far more inflammation than there is pain from the inflammation, if that makes sense. Not all inflammation causes pain, and not all inflammation needs to be treated, just the ones that are causing symptoms like pain for the patient. In other words, there's lots of silent inflammation that's going on, and we don't want to target silent inflammation, because I think there's probably 10 times more silent inflammation than there is painful inflammation. So you would be doing surgery 10 times, 9 out of 10 times would be unnecessary treatment the patient doesn't need, just because you're seeing inflammation on the scan. So there's really an art to it, and figuring out exactly where the pain's coming from, which is why most doctors can't do it. All right, that's it. We're done here. Any more questions?
Yes. One more question coming from Faisal once more on Facebook, asking, Doctor, why do disc replacement surgeries get infected? Why does the device get infected? If the pain is caused by an infected disc replacement device, what treatment would you do?
All right, so medical devices are metal and plastic. They're foreign bodies. Foreign bodies get infected usually during the surgery if they're not sterilized properly by the hospital and they have bacteria on them, or other equipment that's used during the surgery. Same thing. I want to show them that. If you have equipment that wasn't sterilized properly, it can cause an infection. So basically, there's tissue still on the pieces of instruments, and the tissue is infected and it doesn't get processed and cleaned properly. Then what happens is it infects the next patient that you put it into. So the number one reason for infection is basically poor sterilization technique. Duke Spine has the best sterilizers you can buy in the world, and we've had 0 infections with this surgery. So what would I do if you have an artificial disc and it's infected? You're going to have that probably taken out. You could pack some antibiotics around it, debride it, pack some antibiotics around it, hope that it clears on its own, but chances are it's not going to. You're going to have to remove it. That's why it's best not to do artificial disc. All right, you guys see all these pieces of herniation?
Yes, we do.
These are just some of them. This is probably 20%. We have another 80% somewhere else that's in the bag and on the floor. But it's typical to have lots of pieces, not one piece. Any other questions?
At this moment, no current questions.
All right, we'll be back shortly. Stick around and hit the watch button again, but we have to end this stream. We're going to come back for the SI joint. Sacroiliac joint pain, we're going to treat with a rhizotomy.